Welcome back. 1.6 million American teens report using vape pens, nicotine pens that use tobacco in order to get a buzz. Roughly 7.8% of high school students reported currently vaping, 3.5% of middle schoolers. Here to talk about this trend, we bring in Dr. Madeleine Gagnon. Maddie is a pediatrician. She's also a family mediator, and she knows way more than I do about this. So we brought her in as an expert. Maddie, what are you seeing in your office when you talk to teens about this?
Well, the reality is about 1 in 7 Minnesota teens are vaping. And so while some of the news trends have showed since 2019 we're moving in the right direction of getting less kids off vapes, it's still an issue for Minnesota teens. And of those 1 in 7 teens who are vaping in Minnesota, 80%, which feels high, is reporting one or more symptoms of dependence on nicotine, like cravings.
Why is that so bad? I mean, it seems obvious, but why is that so bad for the developing brain?
Great question. I think teens often themselves make the mistake of thinking these fruity flavored, minty flavored, electric feeling pens are probably safer than a cigarette. And I think that's a commonly made pediatric or teen mistake. And the reality is the amount of nicotine, you could also use THC and other substances, but let's keep it to nicotine. The amount of nicotine in a vape, the concentration can vary widely. In fact, you can get concentrations up to equal that of 1 pack of cigarettes or 200 or more cigarettes. So again, that's to say what a wide range of nicotine concentration in vape. That's dangerous. Back to the brain. I want parents to always remember, as we've talked about here, teen brain under construction. Keep that construction sign up in your head, which means it's constantly resynapsing, remodeling. That does not mature till they're in their 20s. So nicotine in particular can impact the dopamine or the reward system. It can alter attention and memory and impact the emotional areas, exacerbating things like anxiety and depressive symptoms.
Do you think that teens look at a vape pen and think, well, this is safe because I don't feel any smoke in my lungs, I'm not letting out any smoke? Does it feel safer? Is there this illusion that it's better for you?
Yeah, I think there's absolutely the illusion. In addition to, they can look like pens, gadgets, fidgets, toys. They can come in all different shapes and sizes. They just don't feel as intimidating or dangerous. But the reality of the impact on the lungs, for example, I was speaking with some pediatric pulmonologists in the Twin Cities, and they are seeing, definitely impacts like decreased tolerance to sport exertion, decreased tolerance to gym exertion, coughing, asthma symptoms. So I think what's hard for teens that we've talked about before is weighing the immediate consequences of, oh, I'm with my friends, I smoke some off the vape, I don't know, really don't feel any different, to that kind of longer term impact of this is impacting my memory and attention in school, this is impacting my lung health. Harder for teens to really see that.
Are they seeing long-term impacts of vape pen use when you talk to these pulmonologists?
Correct. Historically, we've even had a condition, EVALI, the electronic cigarette vape associated lung injury. Thankfully, that was more in the first iteration of vapes, and some of those chemicals have changed, but it's the chemicals and ultrafine particles and toxins, never mind the nicotine, that's in these liquids that get aerosolized and get deposited in kids' lungs.
Oof, when I hear it from you, it sounds real nasty. I was reading that even the secondhand exposure is bad. So the vapor contains heavy metals, volatile organic compounds, and cancer-causing chemicals. So it's not just what's going in, it's what's coming out could also impact the teens around them.
Absolutely, right? So it's all about talking to your kids about the impacts of vapes.
What about the flavors? I mean, we this was like back in my day, it was menthols that we talked about, or flavored cigars or cigarillos, were what they were really targeting. But the flavors really hook the kids.
That's right. Candy flavored, mint flavored, fruity flavored. I think that, along with kind of like its fidget or USB or pen-like delivery system, just again feels more teen friendly, feels less offensive, and I think teens, in honest, kind of make errors about recognizing those consequences. So again, it's really in how parents talk to their kids about this. So keep it casual, right? Don't wait to catch, a vape pen in your kid's backpack. Get talking to your kid about this.
So teen vape use peaked in 2019. But so while teens are starting to vape less, studies are showing that those who do vape are doing it more frequently. So they're
Correct.
reporting that they're doing it every day. So we have the number of teens vaping is down, but the ones who are vaping more.
Correct. So those 1 in 7 Minnesota teens are vaping regularly, per the stats. And what that's also concerning about is pediatric or teen use of substances like nicotine and THC significantly increase your risk for substance use disorder or addiction in adulthood.
And I have to talk to you about this because these nicotine pouches are so popular among teens, popular among adults. Public health organizations like the Campaign for Tobacco-Free Kids point out that as vaping popularity drops, the past month use of these oral nicotine pouches among high school seniors increased from 1.4% to 4.4%. So we're seeing the nicotine pouch on the rise. Is there any difference between the pouch and the vape pen as far as health concern?
Right. With the pouch, certainly you're not going to get the same inhalation exposure to the intrapulmonary or inside your lung environment. However, certainly oral health matters, like we've seen with tobacco or chew, right? The exposure to toxins to your lip health and tongue health and throat health, which often is not something teens are often thinking about. In terms of systemic nicotine absorption, it really doesn't matter the modality, cigarette, pouch, or inhalation through vaping, right? You can get blood absorption of nicotine that's going to impact your brain development no matter how it's getting in.
Right. The American Academy of Pediatrics says any nicotine is bad for brain development. And like you pointed out, a brain is not fully developed until 25. So what about nicotine replacement therapy? If you see a teen in your practice that is so addicted, and I'm sure you've seen this, where they're 17 and they're already have a severe nicotine addiction, you can prescribe nicotine replacement therapy for a patient under the age of 18, but they need a prescription, right? So how does that work?
Yeah, I think it's really important for, first of all, parents to be on the lookout. It's, most teens are not coming to their parents saying, hey, check out my new vape pen, right? So first and foremost, parents need to be aware of what vapes look like. Again, can look like a fidget, a USB. You need to look out if your kiddo's coughing more or sudden change of behavior or wants to go to the bathroom a lot, all the things we look for in substance use. And then, if you come to find out your kiddo is struggling in this way with nicotine or THC exposure, that really is needing chronic substance use, talking to either your pediatrician or other folks who are experts in the substance use field is really key. And there is a key takeaway here. This has to be about parental curiosity and connection, not consequences. And that's hard because it sounds like soft parenting, but at the end of the day, it's about your teen's safety and health, and that's what I've seen key in practice.
Well, and I wanted to ask you this. I mean, where is the line, right? Should parents be searching their kids' cars, searching their backpacks, going through their room to make sure they don't have any paraphernalia, any vape pens? Or what do you suggest? Obviously, every family is different, and they're going to make the decision that's right for them, but what do you suggest? Because there is a line, and sometimes when you're too invasive, that can hurt the situation.
Absolutely, right? I mean, like you said, every family is going to figure out what works best for them, but things that I would recommend to consider is certainly if you're at the point where you think your child is using a vape, they have nicotine dependence or you're suspecting that, and you think you're to that point, and you may need to look in their backpack for something or have hard conversations and get them connected to help. But more commonly than that, it's about having such frequent connections and conversations in passing so that they're coming to you long before it's to that crisis level. So things like, hey, what are your friends up to? I mean, is this a thing? We've seen a lot of this. I know you went to a party last weekend. Are you feeling peer pressured by that? Never underestimating the impact of peer pressure. We know that teens are deeply seated with belonging through peer connection. We've talked before about that. And, lastly, always keeping the door open so that when they do make choices that are harmful to their health and their safety, that they're coming to you. And so, again, it is a fine balance of, being, authoritative enough that you're the parent and that there are consequences for bad decisions, but also the door open enough that when they make a mistake, they come to you. And I say that as a complex care pediatrician, I have walked thousands of families through heartbreaking situations where teens have made life-changing decisions. And when the rubber hits the road, no one's asking me, should they be grounded or should we take their cars away or their phones away? At this point, it's how do we make them safe? How do we make them healthier? And so you always have to center yourself in that of how do I keep them talking and so I can keep influencing around their health and safety, because you want them to make the decision for themselves.
Well, and stay up on current events, right? Because I know too many parents who are like, oh, my kids and their friends aren't doing that. It's
Get
out
real.
there. And I also should note too, I've heard stories of just because you're supposed to be 18 to buy these vape pens, kids are selling them at school out of their backpacks. They're getting it from an adult and then they're selling them secondhand. So there is an off market. It seems kind of silly to say that there's an off market
absolutely.
Marketplace for these, but there is an off market marketplace for teens who want to get vape pens. So they can get them. They might not just be getting them from the gas station, but they can get them.
Older siblings, I've seen that a lot, where older siblings have them, or the younger sibling may take it from them or whatnot. But you're right, selling it or exchanging in the teen or less than 18 market is really easy access. So don't assume, like you said, your kid's not being exposed. And that goes back to having hard conversations. I hear it all the time. I didn't want to talk about that. I was worried I was going to put that idea in their head. I was worried I was going to expose them and influence them in vaping. Couldn't be further from the truth. They are being influenced by social media, by peers. You got to be out in front of that, talking about it calmly, casually. Hey, what's going on? What are you seeing out there? That's going to impact your basketball tournament coming up this weekend. Let's talk about this.
Is there any link between vape use and then, marijuana use or other? Is it a gateway to other drugs and substances?
Yes. So certainly teen use of nicotine or THC is a gateway to increase your risk for substance use disorder and or addiction later in life. So I think, it's just about keeping your kids talking. It doesn't mean that if your kid was vaping, once or twice or a season, right? There's always a good time to stop. There's always a good time to make new decisions. So parents should not, be heavy in that, but should be inspired to keep talking even when they feel uncomfortable.
Wow. Okay. All right, Madeleine Gagnon, also you are the founder of Pulse Mentoring, so you provide teens from ages 13 to 18, right? Mentoring with college mentors, great program. You can check her out that way. But we sure appreciate you coming in and talking to us about this topic today.
Thank you.
We're gonna go to a quick break. We'll be back after this.